Okay, good evening, everyone. You're all welcome to tonight's session and the inaugural discussion on basic neuroanatomy. Um, the aim of the reason why I started this classes is because I found out that a lot of people would message me privately asking about how difficult neuroanatomy is and how they want to learn one or two things on neuroanatomy. And I felt it was important to do it this way, for as much as everyone who's interested, we can go on a journey together to learn about neuroanatomy and understand what the brain is like, the anatomy of the brain, the physiology, and why what ticks in the way it ticks. So my name is Abbas Ajayi, and I'm a neurosurgery senior registrar. Um, you're all welcome to the class. Can anyone hear me?
Yes. Good evening.
Good evening, sir. Okay, so basically we would for today's session we will be dealing essentially on the functional topographic anatomy of the brain. Basically, we'll just do a general discussion on what the brain is arranged like, the parts of the brain and basic functions of each part, before we now delve into the details in these subsequent sessions. I'm sure we've all seen the presentation schedule, and it would be nice if we all try and go through each presentation on the schedule before we start, so that we can all have very good grasp, and then we can share knowledge and rub minds on all that. And then questions are also very much welcome. All right, great. So we'll move to the next slide. Basically, majority of my slides will not have much wording, so I prefer to just speak to the slides. So I will mostly be talking and making descriptions, and then I'll be describing and explaining as we proceed. And then if you have any questions, I'll note them down. You can note them down or put them in the chat box. So the brain is essentially that part of the body that is responsible for controlling the functions of other parts of the body neurologically. It is said to be the seat of the human mind, and it controls everything in relation to executive functions, motor activities as movement, sensation. It controls secretions of hormones and the timing of the secretions. It controls vision, it controls hearing, it controls speech. It controls essentially everything that makes a human a human. Every other part of the body is subservient to the brain. And that's why it is important to study and learn about the brain. For such a very powerful part of the human body, one would expect, of course, that it will have different parts and have different functions. And that's exactly what the brain is like. It has different parts with different functions. You have the cerebrum, which is what we can see on our slide here, which archaeologically or developmentally is referred to as the prosencephalon, basically, which then progresses to have two parts. One part of the prosencephalon is the teleoencephalon, which is the one that is outside. The inner portion is the diencephalon, which is within this area. That's my slide. I believe you can all see my cursor. This area is where the diencephalon is located, this central part. Now, the teleoencephalon, which is the forebrain, has different parts, essentially 5 major parts. have the frontal lobe. Here, the whole of this front from the central sulcus to the front, you have the frontal lobe. Then posterior to it, you have the temporal and parietal lobe. Then inferior to the temporal parietal lobe, you have the temporal lobe here. This is the temporal lobe here. This is the parietal lobe here. And then posterior to both the temporal and the parietal lobe, you have the occipital lobe. Now, the brain, the cerebrum, the lobes have different functions. Frontal lobe essentially is important in executive functions and motor functions. Parietal lobe essentially is involved in sensation, stereognosis, finger cognition, for your ability to be able to spatially recognize yourself in space, spatial orientation, art and artistic thought is essentially from the parietal lobe. Temporal lobe is important in the sense that it is responsible for partly part of the speech center is here, the Wernicke's area is around here, have the auditory cortex is here. Deep to it, you have the entorhinal cortex and the hippocampal system, limbic system, so it's also important in memory. The temporal lobe is also a very epileptogenic area, so it's important in seizure development and risk of injury to the temporal lobe or sclerosis around the temporal lobe can be associated with seizure disorders, so it's important. And also visual issues may also result from injuries to the temporal lobe because some parts of the visual pathway, which we'll subsequently discuss, also loops down through the temporal lobe. Now going to the occipital lobe, you have the basic, majorly it's the sight center. You have the calcrine sulcus where vision is controlled here. Do we have any questions so far? Any questions from anyone for now? Okay, brilliant. I guess we all understand all I've said so far. So this takes us to the deeper structures within the telencephalon, which is the diencephalon. And you have in the diencephalon, you have the thalamus, you have the subthalamic nuclei, you have the hypothalamus, and you have the epithalamus. Epithalamus is essentially a condensation of various nuclei, which which includes the habenula nuclei, you have the pineal gland, and I think you have the posterior commissure. All this all related to what the structure is called the thalamus. Now, there's a question in the chat box that asks about what are the executive functions of the frontal lobe, of course. So the frontal lobe has a lot more functions. I was just trying to, because there's already going to be a talk on the frontal lobe as a whole, but then let's just delve into it since this question has been asked. So the frontal lobe has different parts. You can see it has a motor strip, which is the precentral gyrus. This is the central sulcus here. It's the most prominent line on the superolateral aspect of the cerebral cortex. Anterior to it is the motor strip, and the motor strip is responsible for controlling motor functions. Down below, in the lower part of the motor strip, you have an area called you have you have an area down there that controls speech, which is called what the motor speech area, which is the Broca's area. Now, the frontal anterior, you have three gyri called superior frontal gyrus, middle frontal gyrus, and lower frontal gyrus. The lower frontal gyrus is also important in the sense that, of course, it has, as I said earlier, the motor speech area is down around here. Also called the Broca's area. Then the writing area is also around here. That's the Exner's area. Is also around here. The frontal lobe has functions, certain functions like maintaining consciousness. So it's in the sense that although there are two parts of the brain that is important in maintaining consciousness, you have the brainstem, which is responsible for awareness, and then you have the frontal lobe or the cerebral or cerebral cortex, which is responsible for content. Now, being able to be aware of one's surrounding requires you to be able to have a properly functioning reticular activating system, and the reticular activating system is majorly condensed within the brainstem. But for you to be awake and for you to be able to respond when being spoken to, process information properly when being interacted with, you need a properly functioning frontal lobe. Now, certain things that may affect the ability of an individual to execute the functions that requires him to live or survive or to interact might be lost if one gets an insult to the frontal lobe. Say, for example, one might lose the ability to have interest in pleasurable activities, which is usually called anhedonia, can occur from injuries, especially particularly to the medial part of the frontal lobe. Individual may develop apathy as general loss of interest in anything. Individual may become aggressive, have certain behavioral changes. If there's injury to the region of the medial part of the frontal lobe that controls micturition, the patient may lose inhibition. So it may just go, person is pressed, it just goes in the public and then just pees anywhere. So some of the things. And then, of course, we all know that the long-term memory is mostly stored around the frontal lobe. So that's also very important. So those are some of the things that one needs to know, a few functions that one needs to know. I don't know if we have any questions so far. Any further questions? Okay, excellent. So, I think because today we are being very general. We are trying to be a bit, trying to put everything into perspective for us to really understand where we are going and what we are talking about. So I will really need you to follow me and then ask your questions as we proceed in order to be able to get clarity, so that because by the time we get into the deeper stuff as the classes go by, I will want us to hold these basics at the back of our mind. I don't know if we get it. So now the cerebrum has different parts. I already talked about the parts of the frontal lobe. So superior frontal gyrus, middle frontal gyrus, inferior frontal gyrus have the motor strip. And then the inferior frontal gyrus has three parts. You have the pars orbitalis, which is the front anterior part. You have the pars triangularis, which is in between them. And then you have the pars opercularis. So essentially that's it for the frontal lobe. And then you have the parietal lobe, which has the postcentral gyrus, which is responsible for sensation. That's the sense cortex. You have the superior parietal lobule and the inferior parietal lobule. Inferior parietal lobule is now divided into the supramarginal cortex, and then you have the angular cortex, or angular gyrus, sorry, angular gyrus and then the supramarginal gyrus. Now, these areas are important in the sense that they form a loop at the end of this. So if you see this, there's this dark area. I don't know if you can see my, let me just annotate. See this dark area here. It's called the Sylvian fissure. It's a very important fissure in neuroanatomy. A lot happens within the fissure. It leads to a lot of places, and it's also important in neurosurgery because of the access it provides. In the form of surgery called the pterional approach to the brain, this Sylvian fissure is the first thing you see when you open the dura. And dissecting through it allows you to let out CSF to allow the brain to relax, to be able to access structures deep to the brain. So it's a very important structure. Another important thing is that the upper tip of this Sylvian fissure straddles the angular gyrus, which is important in that it is related directly with the Wernicke's area, which is the sensory speech area. So it's important. So those are some of the things that we need to know. Below here, at the level of superior temporal gyrus, is where you have the auditory area, the medial temporal lobe, and then inferior temporal lobe. And then here at the back here, you have the calcarine sulcus. And there's a question in the chat box that talks about the contents of the diencephalon. I tried to explain that earlier. I will get back again to that subsequently in the talk. Okay. So let's move on from the cerebrum. Yeah, so of course, I tried explaining some of this earlier. So you can see here what I just talked about, area 11. This is the Wernicke's area. You can see here. I talked to you about the loop. This is the Sylvian fissure. I told you this loop, and then at this end, in the angular gyrus, you have the Wernicke's area. Because the visual area is labeled 1 here. You can see it clearly. Then you have, I told you guys about memory. So 2, memory, right? Memory, equilibrium, emotion. So I talked to you about memory being part of the jobs of the front temporal lobe through the hippocampus and the phonesis, the other parts of the entorhinal cortex and limbic system. Motor function area, of course, I told you about that, which is the motor strip here. Area 4 here, Broca's area is here. Told you about hearing. Of course, also hearing auditory area is here. I told you, I think we've also talked about the sensory here, 9, sensory association area is on the other side. Yes, it's here. So essentially, those are some of the things, and it's very important. Talked about planning, judgment, creative inhibition, emotional expression, and all that, all in the frontal lobe here. So essentially, those are the things we already talked about. So we'll just move to the brainstem. Do we have any questions again before we go straight to the brainstem to discuss? Okay, so the brainstem is important in the sense that it has it serves as the part of the brain that obviously directs the tracts from the cerebrum, the diencephalon, down to the spinal cord. It serves as and also connects the the cerebrum to the cerebellum. It also contains a lot of nuclei that have a lot of functions that help in coordinating activities within the brain. It serves as the seat of awareness, consciousness, particularly because of the presence of the reticular formation within it. The brainstem also has importance in vision, in balance. It's important in the sense that contains nuclei that are responsible for cranial nerve functions. And cranial nerves, nuclei of cranial nerves are present within the brainstem. And of course, functions of parasympathetic system, taste, smell, vision, and other specialized senses are contained within the brainstem. So it's a very important structure. It has majorly three parts. I have the midbrain, the pons, and the medulla. The midbrain serves as the initial part, the more proximal part of the brainstem. And it has two parts, or some say three, basically two, the anterior and the posterior part. Anterior is usually referred to as the tegment. The posterior is usually referred to as the tectum. The tegmentum has it holds the branches of the cerebellum. Cerebrum. It carries the cerebropeduncles, which are essentially condensation of motor fibers that come from the brain, cerebral cortex, posterior frontal lobe, down motor and sensory actually, and then down into the midbrain, and then goes subsequently to the spinal cord. You have the posterior part, which is called the tectum. It carries three small round nodules. You can see it here, here, giving it what they call, a name called the quadrigeminal plate. And those nodules are also called colliculi, one singular being colliculus. Colliculi are the superior and inferior colliculus. Superior colliculus, vision, inferior colliculus, auditory. So this are majorly their function. Then anterior to it, you have certain things. You have nuclei which are responsible for vision, important in visual pathway, and also eye movement and pupillary activity. You have the epigastrial nucleus in that area. You have, of course, the lateral geniculate nucleus, which is related to the superior colliculus. You have various nuclei that are responsible for coordinating eye movements and pupillary activity, like the gaze centers, vertical gaze center, particularly in the midbrain, which includes the certain things like the posterior commissure, interstitial cells caja, and various other structures within the midbrain. Part of the reticular formation also passes through the ascending reticular activating system, so pass through here. Then goes to the pons. And then there are some cranial nerves that exit from the midbrain. Of course, you have the third cranial nerve and the third, fourth cranial nerve. Now, then we go to the pons. The pons is literally the widest part of the brainstem. It's roundish, and then posteriorly it carries a condensation of fibers that connect the cerebellum to the brainstem. Have the superior, middle, and inferior cerebellar peduncles. which connects the pons, midbrain medulla, to the brainstem. You have within the region of the lower pons an extension of a cavity of the brain. Of course, we all know that the brain has cavities. It has four major cavities, lateral ventricles, which are related to the telencephalon, that's the cerebrum. So one lateral ventricle per cerebrum. And then both of them connect via the interventricular foramen of Monroe, and then communicate with the third ventricle. Third ventricle is related to the diencephalon. So the thalamus, they both straddle the third ventricle on both sides, and then inferior to it, closely opposed, and inferior lateral to it is the hypothalamus. Of course. So you have then this third ventricle continuing down as a aqueduct of Sylvius, which is a 2 by 2 millimeters tube, quite small, and it conducts CSF from the third ventricle to the fourth ventricle. It is an area where a lot of pathologies may occur within the brain. You can have things like aqueductal stenosis occurring there. If a patient bleeds into the brain, this is a likely site where it's going to get blocked and cause hydrocephalus. Sometimes in patients who have had trauma or infections, there can be gliosis or fibrosis around the aqueduct of Sylvius, and that might result in CSF obstruction and obstruction to CSF pathway and hydrocephalus. So some of these things may happen in patients with hydrocephalus. So it's important to also note this. So the pons has cranial nerves that it gives off, notably the fifth cranial nerve, the sixth cranial nerve, and then, of course, the facial nerve and parts of the vestibulocochlear nerve. They all are we have the cerebellopontine angle where some of this cranial nerve exits from, and it's important to subsequently, we will be discussing the anatomy of the cerebellopontine angle because it's a very important region, and a lot of things have to be discussed. It's something that needs to be discussed for individuals aiming to learn neuroanatomy. So for the pons, again, you have certain nuclei within the pons too. It carries the inferior gaze, the horizontal gaze center. It also carries the trigeminal motor nucleus of the trigeminal nerve. It carries the superior salivatory nucleus, which is responsible for giving fibers to the facial nerve. And yeah, gives fibers to the facial nerve particularly, which is responsible for production of saliva in the submandibular gland, and I think the sublingual glands too. Or the other way around, parotid, glossopharyngeal goes to parotid, I believe. So essentially, those are important things that we need to learn about. And then other things in the pons, you have the nucleus tractus solitarius also extends from the pons down to the medulla, and it provides taste sensation to the tongue. So yeah, some of the important things that we need to learn in that area. Then the pons also is important in the sense that it has, again, the reticular formation. It has medial and meniscal fibers. It has which are responsible, which are important also in the vestibular apparatus and balance and vision. It also has, MLF, medial longitudinal fasciculus. That's very, very important for vision. It the pons also contains structures that are responsible for breathing. So you have the apneustic center here, while in the medulla, you have the ataxic center. Some of the important things that we need to know about these particular two centers are in patients who have raised intracranial pressure and are towards coning. So one of the first things you see is that the patient begins to have the regular change, the abnormal breathing patterns, which can be Cheyne-Stokes breathing, which is usually what you initially see. So the patient begins to have periods of hyperventilation interspersed with periods of hypoventilation. Sorry, I think a lot of people have dropped off. Any questions, any queries? Am I audible? Questions, queries? Am I audible? All right, excellent. So I guess let's move on. So essentially, those are the functions of the pons. So we go to the medulla. The medulla, okay, I think I was talking about abnormal respiratory patterns. Okay, excellent. I was talking about abnormal respiratory patterns. So abnormal respiratory patterns, we have the Cheyne-Stokes breathing pattern, we have the ataxic breathing pattern, have the patient can go into apnea, have ataxic breathing, you have this, so there are lots of um, breathing patterns that can result from patients who have had insults to the brainstem or are having herniation syndromes, particularly those who are coning, having the tonsillar herniation, resulting in compression of the brainstem and which may subsequently result in death from cardiorespiratory failure. Respiratory centers, of course, were the ones I mentioned earlier, the apneustic and ataxic center. There's also the vasomotor center, also within the brainstem. So essentially, those are the important things we need to note about the structures. The the arrangement of this nuclei within the brainstem will subsequently be discussed as we move on. So someone asked about the diencephalon. So essentially, these are the arrangements. You can see here the hypothalamus. Sorry, thalamus, this gray area is the thalamus. Here, you have the hypothalamus around here, down here. This is where the third ventricle is usually located. And then this is the aqueduct serous. So under here, hypothalamus, and you have here, thalamus. This is the pineal gland. This is the abenonal nucleus, posterior commissure, epithalamus. And this is where the subthalamic nuclei are located. So those are the arrangements. I don't know if it's clear now. You can see the hypothalamus here, and you can see that it continues as the infundibulum, which, of course, this is the infundibulum, which of course gives you the pituitary down here. So, any questions on that? Someone asked about ataxia. Ataxia is normal movement. It's one of the abnormal movements. There are different types of. Okay, I don't know if you meant ataxic breathing or ataxic symptoms. Ataxic symptoms. When you say someone has ataxia, it means that their movement is uncoordinated, like someone who is, say, drunk. Movements are uncoordinated. So particularly ataxia is seen in patients who have cerebellar insults or cerebellar lesion. But ataxic breathing can be seen in patients who have the um, who have problems um, with their respiratory center in the um, medulla. I already talked about the respiratory center in the sorry, I already talked about the respiratory centers, about the apneustics, about the attacks, pneumotactic center. Now, if a patient has problems with um, the pons, it can develop apneustic form of breathing. So patients will have long period of apnea interspersed sometimes with periods of normal breathing. The pneumotaxic center, on the other hand, will result in what they call the um, ataxic breathing, which is usually a chaotic form of breathing and usually indicates an end of life situation. Some patients may also have other breathing patterns like the cluster breathing pattern, which actually is more in keeping with the end of life situation. So there can also be cluster breathing pattern, which is even more chaotic than the apneustic type. So I don't know if we have any further questions. Further questions, please. Okay, so um, essentially those essentially that's it for tonight. I don't know if we have any questions or comments, contributions. It's just a general overview for us to be able to like start with something and then learn. Then from here we'll progress to discussion. So, Abubakar, any questions? Who is Dell? Dell has no name. You can unmute and ask your questions or make contributions or whatever you think is okay by you. It's fine. Okay, all right. So okay, someone has made a comment in the chat box. No, the ventricles are not located at the pons. You have ventricles are located all over the brain. So you have the, let me just use a diagram to explain. Right diagram. Anyway, so let me just draw it. I think it's a bit easier. Sure, you can see my screen. So you have this is let's say a sagittal view of the ventricular system. This is the lateral ventricle. This is the third ventricle. This is the fourth ventricle. Fourth ventricle. This is the pons here, and this is the midbrain here. Hmm? And you have, sorry, this is the medulla. Sorry, down medulla, pons, medulla, midbrain. This part is aqueduct. A aqueduct. Aqueduct of Sylvius. This is the upper part of the fourth ventricle and lower part of the fourth ventricle. So everything here is fourth ventricle, okay? This is third ventricle. And this is the interventricular foramen of Monroe communicating both sides and also going into the third ventricle. Is that okay? I don't know if you're clear on this. Now, around here, you have the cerebrum. Around here, you have the diencephalon. Around here, you have the midbrain around aqueduct. Around here, you have the pons. Around here, you have the medulla. Any further questions? Okay, brilliant. Okay, brilliant. All right, thank you very much. I think we can call it a night. A very good evening, everyone, and good night.